This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What are lysosomal storage diseases? Answer: Lysosomal storage diseases are a group of conditions caused by a deficiency of lysosomal enzymes that result in the accumulation of abnormal metabolic products. Question: What is the incidence of lysosomal storage diseases? Answer: Lysosomal storage diseases have an incidence of Tay-Sachs, Niemann-Pick, and some forms of Gaucher disease in Ashkenazi Jews. Question: What are the names of Sphingolipidoses diseases? Answer: Names of Sphingolipidoses diseases include Tay-Sachs and Niemann-Pick. Question: What are the names of Mucopolysaccharidoses diseases? Answer: One example of a Mucopolysaccharidosis disease is Gaucher disease. Question: Can you explain what lysosomes are? Answer: Lysosomes are cellular organelles that contain hydrolytic enzymes that can break down and recycle various types of biomolecules. Question: Why is an enzyme deficiency problematic in lysosomal storage diseases? Answer: An enzyme deficiency in lysosomal storage diseases can result in the accumulation of abnormal metabolic products, leading to cellular dysfunction and disease symptoms. Question: What is the significance of the incidence of lysosomal storage diseases in Ashkenazi Jews? Answer: The high incidence of lysosomal storage diseases in Ashkenazi Jews is significant because it highlights the impact of genetic predisposition and the importance of genetic testing and counseling in populations with a higher risk of these conditions. Question: How are lysosomal storage diseases diagnosed? Answer: Lysosomal storage diseases are diagnosed through a combination of clinical presentation, biochemical testing, and genetic testing. Question: Can lysosomal storage diseases be treated? Answer: Currently, there is no cure for lysosomal storage diseases, but some forms can be managed through enzyme replacement therapy, bone marrow transplantation, and other treatments. Question: How do Sphingolipidoses diseases affect the body? Answer: Sphingolipidoses diseases result from the accumulation of sphingolipids, which are a type of lipid molecule, in various tissues and organs. This accumulation leads to cellular dysfunction and can result in a range of symptoms, including neurological problems, liver and spleen enlargement, and developmental delay. Question: How do Mucopolysaccharidoses diseases affect the body? Answer: Mucopolysaccharidosis diseases result from the accumulation of complex sugar molecules called mucopolysaccharides in various tissues and organs. This accumulation leads to cellular dysfunction and can result in a range of symptoms, including skeletal abnormalities, joint problems, developmental delay, and hearing and vision loss. Question: What is the relationship between lysosomal storage diseases and genetics? Answer: Lysosomal storage diseases are often caused by genetic mutations that result in the production of deficient or non-functional lysosomal enzymes. This leads to an accumulation of metabolic waste products and the development of disease symptoms. Question: What is the impact of lysosomal storage diseases on quality of life? Answer: Lysosomal storage diseases can have a significant impact on quality of life, affecting physical, cognitive, and emotional functioning. They can cause physical symptoms such as pain, organ enlargement, and mobility problems, as well as developmental delays and learning disabilities. Question: What role do lysosomes play in cellular functioning? Answer: Lysosomes play a critical role in cellular functioning by breaking down and recycling various types of biomolecules, such as lipids, sugars, and proteins. This helps maintain cellular homeostasis and allows cells to function properly. In lysosomal storage diseases, a deficiency of lysosomal enzymes leads to the accumulation of metabolic waste products and cellular dysfunction.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the first aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.